Assalamu alaikum. I hope so. You all are fine. Today I am here with Dr. Naghman Zuberi. So today's our lecture is basically on a topic of opportunities for the internationally qualified dentists in USA. So I would like to welcome Dr. Naghman Zuberi. Assalamu alaikum, sir. How are you?
Walaikum assalam. Alhamdulillah, I'm good. Thank you very much for this opportunity because I was getting a lot many inbox messages and emails that please tell us how we can proceed our for our career in United States. So here it is an exclusive, uh, like the presentation is exclusive for the United States only. We are not discussing Canada or any other place, just United States. So I'm going to start now. Okay, guys. So we will be discussing about the opportunities for internationally trained or internationally qualified dentists who want to move to United States or who have already moved to United States and now they are looking into the prospects, into the opportunities, what are available over there, and how they can proceed for it. First of all, keep in mind that the dental schools in the United States, they are categorized as accredited and non-accredited dental schools. There is a Commission on Dental Accreditation, CODA. It serves the public and profession by developing and implementing accreditation standards that promote and monitor the continuous quality and improvement of dental education programs. And on the reciprocal basis, Canadian schools are also accredited by CODA or Commission on Dental Accreditation or CODA of United States. Similarly, dental schools of United States, they are also accredited in Canada. Well, still, individuals attending the dental programs in one country and planning to practice in another country should carefully investigate the requirements of the licensing jurisdiction where they wish to practice. Very important point. Dental studies in United States is a very long journey after high school. After high school, they have to go to university to do their bachelor's for 4 years in health sciences. After that, they have to appear in dental admission test, and on the basis of their credentials from the university and the result of dental admission test, then they are invited for interviews at the dental schools where they have to do their 4 year DDS, and then they have to pass the American boards. Previously, there were two exams, the NBD Part 1 and NBD Part 2, but now it is going to be an integrated one exam. And then which region they want to practice, in those regions, they have to take the regional board exams as well. Well, most of us who are coming from other parts of the world, we belong to the non-accredited programs. Which programs? The programs which are not accredited by CODA. We call those people foreign qualified dentists. No matter they have a bachelor's of dental surgery or doctor of dental surgery, like some of the countries in Middle East, they provide DDS degrees. But it does not mean that if you have DDS degree, you are superior to BDS, or you have BDS degree, you are inferior to DDS from other parts of the world. All of them, they are treated alike as foreign qualified dentists or non-accredited programs. So for the foreign qualified dentists, they have to start the journey, first of all, by documents verification. There are two services, ECE, and their link is www.ece.org. The other one is WES. And some of the universities, they want both the evaluations. So it is better, if you are going for the evaluation, get both the evaluations done in one go. Then you have to acquire the dent pin from ADA. Now, what is this dent pin? Dent pin is dental personnel identifier number. Dent pin. It is a unique personal identifier for professionals and students involved with the US dental education system and standardized testing programs. You have to register for it, you have to acquire it online. There are no charges for that. And that will be your unique ID with American Dental Association for the rest of your life. They always advise that you keep your ADA and your login password safe. Previously, there were two exams which were conducted by the Joint Commission of National Dental Examination, NBDE Part 1 and NBDE Part 2. Now we are going through a phase of transition, and here the old system, it is systematically getting extinct, and the new system is coming. Previously, they have given a separate date. Probably it was somewhere in May that they are going to take the last exam of NBDE Part 1. But because of the present situation, pandemic situation, JCNDE, they have announced that it will extend the last date to take the National Board Dental Examination Part 1 till December 31st, 2020. For all qualified dental candidates, whether they are from American schools or Canadian schools, or they are non-accredited. The NBD Part 2 will be discontinued on August 1st, 2022. After that, if somebody has taken Part 1 exam and they want to pursue for Part 2, they have this limit. After this, then they have to go for INBDE exam, the new exam, INBDE. This exam is in practice at the moment. People are appearing in this exam since the month of July, I guess, and first result was announced in the first week of August sometime. Again, the same JCNDE, they conduct this exam. It integrates content from the biomedical, behavioral, and clinical sciences. It is replacing both NBDE Parts 1 and Part 2. The purpose of the Integrated National Board Dental Examination, it mirrors that the NBDE program to assist dental boards in determining the qualifications of individuals who seek licensure to practice dentistry. No matter a person who is coming from non-accredited program or who is studying at the accredited program, everyone has to take this exam. For the foreign qualified dentists, no matter wherever in the world you were born and wherever you have studied, English proficiency test is required. TOEFL, only IBT is now accepted. No more paper-based exams. There are 4 parts to it: written, speaking, reading, and listening. And it is advised that which program you are going to apply for, look into their requirements. The best part about this TOEFL is you can take it multiple times. There is no harm in taking it for the multiple times. Secondly, you can always improve the score, and you can add your improved score. You can substitute it for your previous score at the CAPID application. There is no harm in doing that. So if you have the score which you feel that is not appropriate, and you want to apply at the moment, you can apply. Later, you can always update your new score. Application is through a portal, CAPID. Many universities, rather most of the universities, they are accepting the applications through CAPID. But there are certain non-CAPID universities as well, and like 4 or 5 universities which are non-CAPID. What is this CAPID? It is by the American Dental Education Association. The ADA, Centralized Application for Advanced Placement, CAAPID, Centralized Application for Advanced Placement for International Dentists. It is available to all individuals who are applying to the participating programs. Applicants to ADA CAPIT are internationally educated dental graduates who wish to practice dentistry in the United States, or after getting DDS, they can even practice in Canada as well. ADA CAPIT includes advanced training programs which are typically shorter in length compared to traditional DDS or DMD degrees. They are 4-year programs in whole of North America, whether it is Canada or it is United States. Well, some of the universities, they integrate these foreign qualified dentists in the second year, and some they integrate those in third year. Again, you have to look into the details. Every information is available on the websites of those universities where you are intending to apply. Now, what you have to have with you while you are starting the CAPIT application. You have to make your profile over there with all your information, your date of birth, your qualifications, the school you have attended, everything. Then you should have at least 3 letters of recommendation. Most of the universities, they want letter of recommendation, at least one of it, from the dean of the university or the faculty where you have studied. It could be a principal of the dental school, it could be dean of the faculty of dental school, whoever is the supreme authority in that dental school. They want one letter at least from them. So some of the universities, they do not have any, like they don't want, or they are not going to even go through your application if that condition is not fulfilled. Then you have to make a statement of purpose. This is basically you are selling yourself. It is your own marketing. They provide you a space. They tell you that these many characters would be allowed to make a comprehensible statement of purpose, why you are here, why you have to move to USA, why you want to study this program, like in this program, and what would be your purpose after qualification. Then TOEFL score. TOEFL score you can easily update. As I have already mentioned, there is no harm. As many times you want to update, you can do that. Then your NBDE exam results, whether you have taken NBDE part 1 or part 2, or you have taken the INBDE. Some of those who have taken NBDE part 1 and they are planning to do their part 2, they can always update their part 2 results in the portal. There is no problem in that. Then you have to also add your evaluation certificate, which you get from ECE. And then you have to go to the list of the program, which is like participating programs, and then you have to choose which programs you want to apply, and then you submit your application. After you submit your application before the due date, so some of the universities, they are on rolling basis. Like the moment you are going to submit your application, probably within a couple of hours or maybe within a couple of days, they start assessing your application. And if they've found that you are one of those candidates whom they are looking for, they will send you an application where you have to go for the supplemental application process. Most of the universities, they have supplemental application process. Here you have to again fill an application form. It could be a paper-based, means they will send you a link where you will download the form, and then you will fill it, then you will scan it, and you will email that. or it could be an electronic form, with like depending upon the university to university. You just have to go to the link with their, you are going to fill the form, and you will give them the supplemental application fee. And then some of the universities, they do not rely on the letters of recommendation which you have already submitted at the CAPE. They want three additional letters of recommendation. Again, some of the universities, they are persistent that they want one letter of recommendation from the dean of the dental school where you have studied. I have already mentioned about the supplemental application fee. Some of the universities, they need other things as well, like maybe your ID picture or maybe your passport copy or whatever. So every university, they have their own requirements as well. So you have to fulfill all the requirements which they will ask you for the supplemental application. After that, they will definitely assess everything, and they will make a list. They will shortlist the candidates, because maybe they will getting applications in hundreds or even in thousands. They cannot interview each and every person. So like they base on some criteria which they have made, and they will call you for interview. Some of the universities, they have only interviews, whereas other universities, they have interview as well as bench exam. Bench exam is for those people who have not attended any bench exam or the lab typodont procedures. There you have to perform certain dental procedures on the typodonts, on the simulated teeth. Mostly they will ask you for a class 2 filling, for a crown preparation, for like cavity preparation, for filling in amalgam, etc., etc. After that, they will go for the final selection, whether you are selected, whether you are rejected, or you are on the waiting list. Most of these students, they apply to multiple universities, and then they select one university where they go, and then the seat is vacant. So those who are on the waiting list, they will be selected on the, again, based on the criteria which is set by the university. It is not that first come first serve. That is again on the basis of criteria set by the universities. Then how you are going to finance your education, because education, especially the dental education in North America, is very, very expensive. Well, if you have your own funds, well, good enough. But keep in mind, it is very, very expensive. Almost by towards the end of 2 years program or 3 years program, you are looking somewhere about 300,000 United States dollars or more than that. I'm just giving you a rough figure, because every university, they have their own different charges and fee, and like tuition fee and all those things. Well, banks also generate loans for the dental education. But most of us who are coming from the other parts of the world, we do not have any credit history in United States, or as a matter of fact in North America. Then you need a cosigner. That person should have a valid job, is making enough money that in case if something goes wrong, that person would be liable to pay for the loan you have taken from the bank. Well, after that, for 2 years or 3 years, it is a rigorous program. You have to be in the university, in the dental school. You will complete your degree, and finally, you will give your regional boards, because already you have given your either part 1 and part 2 or INBDE, whatever suits and whatever the appropriate at that time. So after regional boards, then in that region, you would be licensed to practice. And you can start practice, you can join some practice as an associate, or you can buy a practice. It is always advisable to firstly join as an associate, and then after gaining some feel of the practical dentistry in United States, and then you can buy your own practice, or maybe you can join some multi-practice or multi-clinic practice, etc. There are like so many options out there. Well, some of the students, they say we do not want to go to DDS program. Is there any other option available? Yes, there is one other option. You can go for certain advanced postdoctoral programs as well. But over here, competition is very, very high because limited seats are available, and the graduates from United States, graduates from Canada, they are also competing with you. You do not have DDS, so definitely you are not equivalent to those who have DDS from Canada or from United States. This is the centralized application, again, American Dental Education Association, their PASS portal. PASS is Postdoctoral Application Support Service. It is a centralized application service for individuals applying to advanced dental education programs. This portal simplifies the application process by allowing applicants to complete one standardized application rather than sending your applications to individual universities for each program. Before starting this application, you need to take the appropriate tests required. Definitely, most of the programs, they either want NBD Part 1 or Part 2 if you have already taken. If not, then now INBDE. For foreign trained dentists, TOEFL is also a prerequisite, and most of the universities, they also want for these programs GRE. There are different type of tests for GRE. Here they want unofficial self-reported test results only. Some of the universities, they also need another test called ADAT, the Advanced Dental Admission Test, which is again being conducted by the American Dental Association. And it has again the same type of questions as for your INBDE. It is having basic sciences as well as clinic sciences MCQs. Well, some of the people, they are good with their masters and they go back to their countries, and over there they want to get involved in the education, dental education, in the academic, etc., etc. Some of them, they want to even excel in the field, and they want to have the diplomate of the American Board of Orthodontics or maxillofacial surgery or endodontics or prosthodontics or whatever. What is this board certification? Board certification means that the specialist has met the highest requirements of competence within the specified field. Achieving the status of board certification demands an immense amount of dedication and hard work beyond the regular rigors of a specialization education. So after a specialization education, they have to appear in the exam, they have to present some cases, case synopses, etc., pictures of their completed cases, and then they are awarded the diplomate. Well, another query which I was getting, that is there any chance that we can go into the direct licensing in United States without going to any dental school? Yes, it could be possible, but that opportunity is available only in very few states. I know for sure that it is still in Minnesota, but again, you need to be very, very outstanding person, like not just a BDS graduate with 1 year house job with you, and you are planning to start the direct licensing procedure, or maybe you will be allowed to go for the direct licensing. That is not possible. Even for the direct licensing, you need to give the NBDE exams, like if you have already taken Part 1 or Part 2, or you are planning to do it. So INBDE would be the exam, and then you have to also pass the regional boards. If you are not coming from the dental school, then appearing in the regional boards is going to be slightly expensive because you have to arrange your own patients. Well, those who are with the master's degrees from England, but master's degrees 2 years program, not 1 year program, 2 year full-time program from England. Those are like after your BDS, and then if you have 2 years master's program in one of the fields, clinical fields, not the theoretical field, clinical field like maybe operative dentistry or conservative dentistry or maybe endodontics or orthodontics, something like that. Then those states, they can think in letting you appear in the regional board exam, and then they will give you the license to practice over there. Another uh, way of getting into the process is general dental residency programs for foreign trained dentists. Over here, the advanced standing program for foreign trained dentists, it does not focus on a specialization, rather all these subjects taught in a dental school, as you are having a condensed DDS program. It is basically a bridge course making an international dentist equivalent to any US trained dentists. So with this program, you will repeat 2 years of dental training to be eligible for dental licensure in the United States. There are certain, I have just got this information from the internet, maybe I'm missing on certain programs, and you have to find out the programs in the states where you want to settle down. Some of the programs, they are just designed to practice in that particular state. You cannot practice in any other state. So general practice dental residency programs for foreign trained dentists, as I told you, Howard University, Tufts University, Metro Health Medical Center, and Abington Memorial Hospital. Probably Columbia University is also one of those in New York State, which is providing this type of facility, as well as probably one or two programs in Florida as well. But for that, you need to stay in Florida, as per my knowledge, because I know some of my students, they went for that program after doing their part one and part two, and they are settled in Florida. So I'm not sure if they are allowed to practice in any other states as well or not. Another thing is that till like a couple of years ago, maybe 2 or 3 years ago, there was a dental school in Mexico, and doing your 2 years DDS program from Mexico, and after doing your part one and part two exam, and then doing the regional board exam for California, you were allowed to practice in California. I'm not sure whether they have increased the time or not, but we can always find it out on the internet. And what is the situation after this pandemic? Yes, recently, one of the programs in Eastern Europe are also recognized by the California state, and doing your DD, because I know for a fact a student of mine, he did his 2 years program from that university, and I can always get you introduced if anyone is interested to that student of mine, and they can guide you in that context as well. But for that, you have to stay in Eastern Europe for 2 years. And then after that, meanwhile, you have to pass your American boards, as well as you have to pass the regional board for California, and then you are allowed to practice only and only in California. The last few words are that when you are deciding to choose to migrate to another country and start your career over there, choose your path wisely. So many paths are available, but you have to see what are the limitations for you, or what could be the opportunities you can take, what are your credentials, and where you want to go. Another thing is, people ask, is there some shortcut? There is no shortcut. there is never a shortcut to success. Everything takes time. If you are impatient, if you do not uh, want to invest your time, your efforts, your energies to gain the success, then these programs are not for you. I'm just letting you know beforehand. So over here, whatever the overview I wanted to give you in this short time, I have provided you. Any further queries, any questions, they are always welcome. You can always send me the queries or to the owner of this channel, and I will definitely get back to you on that. So now over to Farooq.
Thanks a lot, sir, for a very great lecture. I hope it is very helpful for all the dental students here. Again, sir, thanks for the time and thanks for the great lecture. Khuda
Thank you
Hafiz.
very much. See you after 15 days on some with some new topic. Thank you. Bye everyone. Allah Hafiz.
Khuda Hafiz. Khuda Hafiz.